My name is Neil Springham. I'm a consultant art therapist and I'm also head of art therapy across the Trust. And that means I'm involved in both delivering art therapy as a psychological therapy, but also involved in social inclusion where it involves the arts. Art therapy is really very much like it sounds. It's working with people therapeutically using art. So someone would come into the room and they'd make a piece of art and we'd try and build up communication through their art. So it's a way of helping people to talk about things that is hard to put into words.
My name is Elet Gorbani. I'm a service user.
Hello Elet, come in.
I was referred by my psychiatrist for an episode of 6 to 9 months art therapy after I had psychosis. Personally, I thought I was beyond help, so I was consumed by a lot of thoughts that weren't based in reality.
The kind of people who would come to art therapy in the Trust would be those people who have quite serious and complex mental health issues. So that would be schizophrenia, other forms of psychosis, quite serious depression and personality disorder.
Art therapy was something new for me. I've never heard of it. I knew from school time that I had, in my background in education, I had some lessons in art, but that's all about it. I never realized how effective or what kind of impact it can have.
Often people have art therapy alongside other interventions like medication, or perhaps when they're working with a community psychiatric nurse. Sometimes people have art therapy when everything else has been tried. That's been quite a pattern in art therapy. I think nowadays people think of art therapy a little bit earlier for people, particularly where they have serious communication problems.
Talking was the main thing that I couldn't do very well at all, then especially. And I was given a paper and I had different mediums from pencil to watercolor to pastels, which I quite like, oil pastels especially. And I could sit there and the first few sessions went by in a very quiet, silent way because I was resisting to talk. Gradually I opened up and it gave me a window to talk about my inner world.
I see my role as an art therapist as being involved with treating people as a psychological therapy, but also to think about what comes after the treatment, because that's very important, because people suffer a lot of isolation, a lot of stigma. I do a lot of work going out to local arts organisations, in a sense to make them more mental health friendly, so that they can take the people that we see, and actually people can have a life within the arts. And actually there's a lot of evidence now that the arts can be very, very useful for supporting people and giving wider participation.
I'm glad to say now a piece of my work has been published in a magazine called Reflections.
This is a fascinating job. It's always different. You know, people are the most fascinating subject there is, and actually working with the arts is just wonderful. A lot of what we do is just trying to understand how to maximise the potential of the arts, both as a psychological intervention but also social intervention. What could be more interesting than that? My
art therapist was like a guardian angel for me. She brought the worst and the best out of me in that period that I had with her during art therapy in that 9 months. And I came out as a better person, thinking somebody cared to listen.